Warringah.
Thank you, Madam Deputy Speaker. For too long, issues that impact women's health have been ignored. With more women in Parliament, there is no doubt that we are seeing more focus on women's health issues. After all, women make up 51% of the population, and despite tremendous strides in healthcare, women's health continues to be areas that need more attention. Physical health issues like endometriosis, perimenopause, menopause affect half the population. We will all go through it. Yet they are surrounded by stigma and silence, and that has been the case for too long. And we must remember, of course, that mental health issues should not be ignored. We need to look at complete body health, mental and physical. And in fact, this week is Body Image and Eating Disorder Awareness Week. And it is a really timely reminder of the importance of having healthy body image and conversations. It's also a reminder that mental health challenges, particularly around body image, are especially confronting for young women. In Warringah, we are over 78,000 women. These are mothers, sisters, wives, carers, professionals and volunteers. Our electorate is fortunate to have outstanding organisations that show the value of early intervention and compassionate care. I've visited some of these recently and I want to give them a special mention. Tresillian has for generations provided support to families adjusting to the challenges of early parenthood. I recently visited their facilities and it was just incredible to see the level of support for young mothers and young families that they have been offering for so long. The Gidget Foundation, again out of an incredible tragedy, has come the most amazing organisation that offers trusted and specialised mental health care for new and expectant parents. And the Butterfly Foundation, which is an incredible organisation as well, providing essential treatment, resources and support for those affected by eating disorders and negative body image. These organisations demonstrate a vital truth. A women's health cannot be separated into physical and mental health boxes. They're deeply connected, and in our policies and health services, we need to reflect that reality. It's as true for young women struggling with body image as it is for midlife women navigating menopause. And while there is access to these important services in our electorate, in Warringah and in urban and in city areas, the same is not true for First Nations women, and we must always be incredibly conscious that we still do not have parity in Australia when it comes to access to health services for all Australians. And again, also for remote and regional communities, we know it is incredibly difficult to access that same level of care. When we think of that access to health, it's incredibly important, again, to look at making sure we have culturally safe, comprehensive health care for First Nations women. Now, we know, for example, that around 1 in 9 Australian women live with endometriosis and often have waited years for diagnosis. In fact, around 80% of women who have experienced menopausal symptoms, and 1 in 4 experience them severely. And then eating disorders are among the most fatal of all mental health conditions, disproportionately affecting women and girls. And yet there is still proportionally very little services available and support. So with these realities, women's health has historically been under-researched, underfunded and under-recognised. For decades, women are told their symptoms were just part of life or sometimes dismissed without proper consideration. In fact, menopause will impact all women at some stage in their life. It's mostly between 45 and 65, but that the perimenopause period occurs, but of course menopause and postmenopause periods will also occur, and it often impacts women at the peak of their careers, and it's often misdiagnosed, poorly treated, there's inadequate treatment too often, and they all have adverse impacts on women's careers, health, and it all contributes to that unequal economic outcomes that we know women in our society still suffer. And so I do commend the government that there has been an increased focus and spending on those aspects, but it must continue. Celebrating small gains is not sufficient until we really get to that parity that is necessary. And of course, we need to elevate and make sure there is awareness of these issues and health conditions, and make sure our GPs, for example, are much more cognizant of these more specific issues when it comes to women's health. For wellbeing, for workforce participation, for families and for communities, we need to ensure that all areas of women's health are properly addressed. So what can we do? Of course, the government, funding Medicare rebates for longer consultations that address both mental health concerns is something to be considered. We continue to partner with proven community services, and I urge the government to support services like Tresillian, like the Gidget Foundation, like Butterfly Foundation, who build out holistic, family-centred models of care. We need funding for genetic screening for ovarian cancer. It still has the most horrendous outcomes and will devastate families, has huge consequences to the broader family unit. And we need to track outcomes. Women's health must not remain invisible in national reporting. There is still a long way to go, but it is good to finally have women's health on the table, being discussed in this place. And I do think it is overwhelmingly because there are more women in this place, whether it is on the government ranks or the crossbench ranks. Still falling pretty short on the coalition ranks, but that is something for them to address. We know if we fail to act, women will continue to be dismissed, symptoms will be minimised, their health outcomes compromised, and we will all suffer as a nation. If we act, we can deliver equity, reduce stigma, and build health systems that value women's well-being at every stage of life. Now, finally, we can't talk about women's health without talking about intimate family violence. We know intimate partner violence is the leading cause of death of women aged between 25 and 44. Now, that's a pretty sobering fact when you think of all the other aspects of women's health, that it's actually at the hands of intimate partners that their health is most at risk. It's what causes a huge amount of hospital presentations, disruption, and it's just horrific to think that it's still from the fatalities that are still occurring. So there's still a lot more work to do. We are in a decade and in a plan from the government, but it is lacking KPIs and underpinning policies to actually achieve the stated outcome of eliminating intimate partner violence and fatalities from domestic violence this decade. And so I urge the government to really consider the independent recommendations that have been made. For example, the Rapid Review report was commissioned just last year in response to the spate of killings that were horrific. Experts came together to quickly, rapidly provide a key roadmap to the government of how they could act promptly. But unfortunately, key recommendations have not been acted upon, and these include restricting access to alcohol, especially home deliveries of alcohol, restricting gambling advertising. All of these areas have links, direct statistical links to increased rates of domestic violence and intimate partner violence. So these issues you can't pick and choose which issues are more politically easy to address or convenient. If we are going to talk holistically about women's health, we have to address all of the factors that impact that. So I urge the government to not be selective and to tackle the hard ones like gambling advertising and access to alcohol and for its impact on intimate partner violence. Thank you.